with the educational background that I have, with now the knowledge of something that I've never delved into until the last year and a half, this is something I understand it works, and the process works. The understanding of the pathology of hair loss is been developed, and the treatment attacks every issue, and this process works. It makes sense. It has scientific merit to it. There's a thought-out process to this therapy. It's not about this is one thing that causes hair loss and this is how we're going to treat it. It's more of a philosophy, look, this causes hair loss. There's 4 or 5 ways to attack it. Let's attack all 4 or 5 approaches to it. And that seems to be what this approach is doing. I know I'm only 27, but it's quite a bit on a guy when you look in the mirror and see your hair falling out. As much as she kind of said, you know, wow, let's look at how much growth you've got here, and that's where the pictures proved what she had assumed. Only when we look back at pictures can she say, this is incredible, how much you've actually got back, how much thickness and fullness you've developed. At 27, you feel worried when you look at the mirror or you're in the shower and hair's coming out in your hands, and it feels a lot better when 6 months later the hair's thicker and it's fuller. I feel a lot better about myself, more confident, and actually different things you can do with your hair are more amazing. From where you're thin, it just kind of would hang down. But I feel, you know, younger, rejuvenated. It was amazing to actually see the difference from what I came in with, from where it had been. See, every single day I see it in the mirror, so it's no surprise to me. My hair is growing back. It's real. As a medical doctor, let me tell you, this really works. Treatment's simple. Come in for 30 minutes twice a week and watch TV while you're under the laser.
My name is Shirley Vaught, and I had gastric bypass about 2 years ago. Due to nutritional deficiency, my hair started thinning out, and so I went to a dermatologist, and the dermatologist told me there was nothing that they could medically do. So I seen an ad in the paper for the laser, since I've had to wear a wig for the longest time because of the thinning of my hair. I felt very uncomfortable wearing a wig when I was around my family. My family would stare at me and look at me, and then when somebody would come to my front door, I would run to put my wig on and fix it real quick, so that way they would never see me without a wig. I seen an ad in the paper on the laser therapy and decided to try it, so I called and got a consultation. Went in for the consultation, decided to go ahead and give it a try. So I come in and tried it 7 weeks later. My hair was looking thicker and fuller, and it felt so much better. And now at 7 months, I don't have to wear a wig, I don't have to wear a hairpiece, and it is my hair, and it's wonderful. 2 weeks ago was the first time that I had my own hair, and it was wonderful to be able to go in and get my hair highlighted and fixed and not have to wear my wig when I walked out, and be able to be proud of what I have. You know, the laser has been a miracle.
That all new at 5:30. We've all heard of laser hair removal, but we're going to tell you about this new technology using lasers to stimulate hair growth.
But how about a laser that can reverse balding? And you can have this procedure done right here. A low-level laser is showing great promise for reversing hair loss. It's already been approved by the FDA. Channel 3 Eyewitness News reporter Irene O'Connor introduces us to a Connecticut mother and daughter who say this treatment really does work.
Lorraine and Michelle Barber say a new low-level laser treatment gave them more than their hair back.
Well, it gives you more self-esteem.
It makes you confident.
Daughter Michelle discovered the laser treatment first after Rogaine didn't work, but it only took a couple of sessions of the laser therapy for her to see results.
It's just like my normal hair.
So when Mom began to see similar hair loss problems, Michelle insisted she try the new technique.
I'm not a believer of things until I try it, and I tried it.
Lorraine had just as much success as her daughter, seeing results after about 4 treatments.
Instead of getting my hair cut like every 7 to 8 weeks, I started getting it cut every 4 weeks. My hair started growing like crazy.
To get full results, you have to commit to a full year of weekly laser therapy sessions. Each session lasts about 20 minutes, and users say they don't feel a thing.
But ours is a cool laser, and it's 100% safe.
The warm laser used in hair removal may damage tissue, but the cool laser used for this is harmless. The cool laser increases cell activity in the scalp, providing a stimulation that stops hair loss and provokes regrowth. The laser therapy has also been recently FDA approved, but everything good does come with a price.
The fee for laser is typically for a year's worth of treatment is about $3,000.
$3,000 may seem high, but to Lorraine and Michelle, every penny was worth it.
I'd recommend it to anybody to give it a shot because there's no price that you could put on saving your hair.
Both mother and daughter have finished their treatments and have seen no problem since. Irene O'Connor, Channel 3 Eyewitness News.
If you're wondering what Dr. Orton's doing, I can tell you he's not sitting under some high-tech blow dryer, but he is actually getting a breakthrough new treatment for one of the most embarrassing medical problems men and women suffer with. What is it? We'll tell you later.
The Doctors is all new today. Coming up right now on The Doctors, where MD meets TV.
Now, we were surprised about the amount of requests that we received for help about this next problem we're going to deal with. While we can tease about some embarrassing questions, this next home video is one many can relate to, and it's not a laughing matter.
Hey doctors, my name's Lacey. I'm 26 years old and I have a major problem. 6 years ago, I was diagnosed with female pattern hair loss. I have a bald spot right on top of my head and it is very thin, and I'm always looking for a new treatment. Can you help me, please?
Up next, whether you're afraid this may happen to you or like Lacey, you're already seeing signs of hair loss, we'll show you what you can do right now to stop it. There are probably very few things more devastating for a woman than hair loss. Unfortunately, 1 out of every 4 women will experience it in their lifetime. Sure, guys go bald all the time, but when we got a home video from a 26-year-old woman struggling with hair loss, we wanted to find more about Lacey's story.
I remember looking in the mirror one day. I did one of the swooshes back, and when I saw all the thinness in my hair, I was terrified something was wrong with me. So I ended up talking to my doctor, and I got sent to a specialist who did an actual scalp biopsy on my head and came back just as female pattern hair loss, and I was only 20. My hair didn't really fall out all of a sudden. When I was younger, I had a huge head of hair. I don't know if I just didn't notice or it was just gradually thinning. If I'm going out with my best friends, I could take up to 45 minutes just messing with my hair. I'll tease it, I'll comb it different ways. There's a full list of things I have used. Volumizers, root lifters, gels, nothing cuts it. I take the minoxidil twice a day. I've been on that for 6 years. Maintaining this little amount of hair that I have can be expensive. I've wasted probably $4,000 or $5,000, I'd say. I try to joke about it, but it just hurts. I'll say at least I'm thin somewhere, but but it really is just a cover-up of how I really feel. I'm terrified of going completely thin where I need to wear a wig. Some days I have such a bad day where I feel there's no hope for it. Every time I look in the mirror, I see it. Every day I'm trying to hide this.
Lacey is here with us. Thank you for being here. You know, this is common. You know, there's nothing to be embarrassed or ashamed about. We have Dr. Craig Ziering. He's a hair restoration specialist with us. Thank you for being here. You know, this is not that uncommon, is it?
No, Lacey, you're not alone. There are over 35 million women in the United States alone who suffer from hair loss.
We have an animation to show the difference between the way a male may bald versus a female, because it is different.
Yeah, absolutely. Most men bald with a discrete bald spot. They often lose from the hairline or a bald spot in the back. But what women do is they maintain the hairline, like you are, Lacey, and then thin diffusely behind it.
So what exactly, Dr. Ziering, is happening at the level of the hair follicle when we talk about balding and hair loss?
What's actually happening in what you're experiencing, Lacey, is the hereditary form, and it's actually a miniaturizing of the hair follicle. So they get weak, wimpy, they lose their color and texture. They just get smaller and smaller and become baby fine, and actually you don't aesthetically see them anymore.
You've got some exciting new technologies that you can use to check the thickness of hair, to check the health of hair follicles.
Exactly.
So show me what that funky machine is you've got right there.
Yeah, this is a video microscope. It comes with our Rivage system. And actually what we can do with this is we can actually look here on Lacey's head, and you can see this is where she's miniaturized and thin, and there's gaps in space.
Some of the common drugs that men use, Rogaine, Propecia, etc. Do those work in women?
Well, Propecia is a medication that is not prescribed for women. Men can use it, but minoxidil is a topical therapy that many women use. But there's a new exciting therapy out there that I think will be extremely beneficial for Lacey.
Because nothing's worked for you, right? But that's why you're here.
I know.
That's why you're here.
I know.
Dr. Ziering has brought with him what may be the most promising treatment yet for female hair loss. It's available today. Coming up, we'll show you how this breakthrough new laser works and what you can do at home to treat your own hair loss right now. So are you noticing anything in there? You feel anything?
Feeling it burn.
You're feeling it grow?
Yes.
I wish there was a fix for this. I would kill for thick hair. I try to joke about it, but it just hurts.
I'll say at least I'm thin somewhere, but it really is just a cover-up of how I really feel. I want help.
Hair restoration specialist Dr. Craig Ziering has brought a brand new laser with him to treat Lacey's thinning hair. So I hear some beeping going on. Talk to me about what this laser's doing.
Well, this is the Rivage 670, and what this is doing is it's rotating 30 diodes in here, and this light is coming down and giving full coverage over her entire scalp right now. What you see there is the energy is being absorbed by that hair follicle. That light stimulates the energy, which stimulates cell metabolism, and it also increases blood flow so that the cells can allow the hairs to grow thicker and fuller.
So it basically allows an environment for the hair cell or the follicle to thrive.
Yes, absolutely.
So are you noticing anything in there? You feel anything?
Feeling it burn.
You're feeling it grow?
Yes. No.
It actually is a cool laser, so she really shouldn't feel any heat or anything happening with regard to that. It's all happening at the, via photostimulation at the molecular level.
So how many treatments might she need before she sees an effect from this?
She can see a result in as little as 4 to 16 weeks. Our patients at Advanced Hair Growth Centers, what we do is we give patients a full year of treatment. They come 2 to 3 times a week, and it's 20 minutes at a time.
And how much would a year's treatment be?
It's somewhere between $3,000 to $5,000.
So let's say she gets a year's treatment, and then Lacey at the end of the year says, okay, I don't want to do this anymore. Will she maintain, or is this laser, does it need to be used for the rest of her life?
You'll want to have some kind of maintenance program, and we offer that for our patients. Sometimes it's once a month, once every 3 months, and other people come because they like hanging out with us at the office and come once every couple of weeks.
Well, we actually have a before and after photo of a woman named Shelly who used this very same Rivage 670 machine, and it's a pretty impressive difference. And Lacey, I want to introduce you to Shelly because she's here in our audience. Shelly, thank you so much for being here. You're basically giving hope to Lacey, right?
You're a beautiful woman, and it will work. You just have to be patient.